rather than going for just simple abdominal ultrasound. So KUB ultrasound is usually which is done. And the second thing is PSA level was missed, and rest of the things were all perfect.
Yes.
Another thing, if it is a benign prostatic hyperplasia, shouldn't we do uroflowmetry with postpartal residue?
Definitely. It should also be mentioned. This was also missed.
Yeah. That you can also.
Thank you. I just remember that, Dr. Prabhji.
Thank you, Dr. Yeah, Dr.
This KUB ultrasound or X-ray? I'm not sure about that. Can we say
KUB is X-ray? KUB ultrasound. Okay, it's abdominal ultrasound.
No, ultrasound.
No, actually,
I think ultrasound KUB is also
urinary bladder region, ma'am. So you can do an X-ray, you can do an ultrasound, no problem.
Okay.
Yeah.
So what was your question, Dr. Varki?
No, I didn't know that the KUB ultrasound is available. I was not sure. In my part of the world, they don't. I have not heard of this.
Okay.
It's actually called KUB ultrasound with MCC and PVR. Okay, PVR postpartum residual volume, and MCC, that means maximum bladder capacity. So you can just say that you can do it. And about the flow, you can do the uroflowmetry to see the velocity, the maximum velocity, average velocity, something like that. That's a graph actually. Yeah, you can say things like that, but actually that takes a specialist or opinion. So you can just say, I will discuss with my senior or multidisciplinary team, then I can do this. That's it.
Yeah.
So Dr. Abhishek, it was.
Thank you, Dr. Prabhji.
It was a good question that whether ultrasound KUB is done or not. I'll ask some radiologists and we'll get back with that answer tomorrow, maybe, or in the group.
Yeah. Good.
Yes, Doctor. May I ask you a question?
Yes. You want to ask Dr. Varki or Dr. Prabhajit Singh?
Who is presenting Dr.
Yes,
Varki,
Dr.
right?
Varki. Yes.
Yeah.
Yes,
How do you differentiate? How do you differentiate this from a neurogenic bladder?
Good.
I can ask about any weakness in his limbs or paresthesia or numbness of his lower limbs or legs.
Or numbness around the perineum, mostly in the genitals, like the distribution of S2, 3, 4, I guess.
Yeah, at this age, this kind of things in neurogenic bladder and retrocellular activity can be a cause of this
overactive or underactive. Like in this case, actually, it may be the underactive bladder. Actually, any previous history of a stroke or something like that, any injury or trauma, this can be asked.
Yeah. So in the history, you could have asked about something like, do you have any history of trauma?
Yeah,
stroke.
Yeah, underactive bladder is a good differential for this station also. Yeah.
Yes. So in his just to make it more clear, we have to ask like what all things has to be asked in history: trauma, weakness, stroke. Other than that,
no. It depends on have you considered this diagnosis as differential. If you have considered
No. I don't think with the stem which was given by ma'am. Which was given by ma'am actually mentioned hesitancy and initiation and all these things, but retention of the urine was not mentioned over there. So I think it's okay in this condition that Dr. Varki did not ask. It will be fine because there is nothing mentioned regarding the retention of the urine. So maybe because of if in this
scenario of chronic urinary retention, like there is incomplete sense of incomplete voiding, Dr. Prabhajit, or something like patient may tell you that he's feeling kind of heavy nowadays, there is incomplete voiding and that line was written. So it's an station about this chronic urinary retention. You can be sure about this.
I got it, but here in the stem it was not mentioned. Probably that's why Dr. Varki did not mention in during the
it's okay.
taking.
It's okay. It's okay, I guess. Yeah.
Actually, thank you for reminding, but I just don't know what things has to be asked to differentiate to get a negative history of
You
neurogenic
named
bladder.
it right.
That's
You
what
named
I
it right, Dr. Varki. The
Yeah.
backache, the lower limb weakness or numbness in the
Yeah,
perineal area, as Dr. Abhishek mentioned.
oh,
That's
Or
it.
history of
okay.
stroke or trauma.
This
Okay,
satisfied
okay,
Dr.
fine.
HK, otherwise he would have answered you. You
No,
answered
yeah,
correctly.
yeah, those are questions to be asked. Any
Yes.
history of fall or any injury, because at this age the patient tends to fall, and these
Yeah, they
things can
can.
occur.
Yes.
Yeah,
That's right.
72
Yeah.
years of age. Yeah,
Yes.
thank you.
Thank you, Dr.
Very good.
Steve.
Thank you
Thank you
so
for the point.
much.
Thank you.
Thank you. Okay, started the timer and here is your question. Right, if you have read and understood the question, kindly begin your history taking station.
Yeah. Good morning.
Good morning.
My name is Dr. Zaid. I'm one of the surgical doctor on the clinic today. Could I confirm your name
Hello,
and
Dr. Zaid. My name is John. My age is 33 years.
nice to meet you, John. How can I help you?
Doctor, recently I've seen that this was a problem I was having in my lower genital, just nearby to that in the groin area. I was having this swelling, but for a few days or maybe a month, you can say, this swelling is getting me more problem. It's not getting, reduced in size now, and it's becoming more painful.
Here.
Yes.
I can't say that surely that it used to disappear, but the pain is the more problematic part now.
Okay. The pain start with the swelling.
It came a little bit after that, maybe
After that.
a month after that. Yeah.
Okay. About swelling, the swelling increase since time you are notice or decrease or the same?
It has increased only a little bit, but more or less it has been the same.
Okay. Any skin change?
Not really.
Any rashes, swelling, redness, or any discharge?
No, doctor. I did not see any discharge coming out. It's just the swelling and now a little bit painful.
Any bump or lump anywhere else rather than this one?
Not really, doctor. No.
Okay. Any ulcer in your genitalia or your leg?
No, doctor. I don't have any ulcer.
Okay. Have you had any fever?
I do not. No fever.
Any night sweating?
No. Nothing like that.
Okay. Okay. Could you describe the pain, please?
Yeah, pain is just a little bit. Actually, it was not much painful earlier, but now it's causing a little bit of pain over that swelling area. But that's not the main problem. It's the swelling which is troublesome to me because I don't know how this has happened. And it's in the private area, so I'm more concerned about that.
Yeah, I understand that. Okay. Can you explain for me more how this pain and swelling is affected your daily life?
You know, I always feel ashamed. I have this difficulty in wearing the belts. It's painful with that sometimes. But
Yeah.
apart from that, it's not affecting the daily life much.
Okay. Who do you live with you at home?
I live with my wife.
Okay. Do you smoke?
No, doctor, I don't smoke.
Do you drink alcohol?
Occasionally only.
Occasionally. Okay. Do you have the same pain and swelling before, or this is the first time?
This is the first time.
Do you see your GP for any reason?
Yeah, doctor, previously I was told that I had some this tummy pain, but that's too long ago. It's not recent. And that went off in a day or two. And apart from that, everything is normal.
Okay, did you have had any surgery before?
No.
Okay, do you use any recreational drug?
No, doctor, no recreational drug, but you know, I'm a gym trainer and I take this stamina tonics. That's regular thing which I'm taking, but apart from that, no other medicine I'm taking.
Okay, do you travel abroad recently?
Could you ask that again?
Did you travel abroad recently?
No, I did not. Oh, doctor, now I remembered. I have this this infection in my urine. It was a few months ago, maybe 7 months ago. I forgot to tell you that.
Okay, you have a problem with your water work 6 months ago.
Yes, I had
Okay,
infection over there.
And did you treat it for it or just?
Yeah, I was treated with some medicines, and then it went fine.
And everything is going well.
Yes, after that, everything is fine with my urine.
Okay, well, what do you think the cause of this problem? Do you have any idea?
Yeah, doctor, actually, I had this injury over here. Somebody actually kicked over here. I had a fight, and I found that after that, probably maybe swelling is because of that. I don't know. I just wanted to tell you that.
Do you hurt yourself after that to appear swelling notice?
Could you ask me that again?
You hurt yourself after that you notice the swelling?
Yeah.
Okay, do you feel any pump-like sound after you hurt yourself? Okay, thank you. Thank you.
Thank you so much.
Thank you. I'm taking a history from a 33-year-old gentleman.
Yes.
He has a swelling in his right groin. This swelling 4 months ago, followed by pain. Pain is just discomfort. He have a history of UTI and treated for it. He didn't have any allopathic medical or surgical history. Did not smoke or drink.
Yes.
Most probably the patient have inguinal hernia, but
yes.
I should exclude other cause of inguinal swelling like lymph node.
Yes.
It could be a primary cause like infection, or benign tumor, or malignant metastasis, or lymph node like lymphoma or others.
Okay. How do you plan to go ahead with your patient's management?
I will examine the patient,
yes.
examine the genitalia, examine the lower limb if there is any wound. I will send for the patient CBC, SARS-reactive protein, and inflammatory markers, renal, liver, and I will do for him ultrasound. If there's any suspected of lymph node enlargement, needle aspiration, and CT scan abdomen and chest for work up for staging if there's any tumor or metastasis.
Can you tell me how does the hernia occurs?
Hernia is a bulging of the intra-abdominal organ through the weakness area of the abdomen, secondary to increased intra-abdominal pressure.
Can it get better?
Sorry?
Can hernia get better?
Is not get better. If the hernia is there, that means that something has happened. You need to correct or conservative management.
Then how would you do it? What is the management options?
Management by herniorrhaphy,
Yes.
laparoscopical or open.
Yes.
Yeah.
Okay. Can you tell me if patient would be fit to go back to work?
Yes, he can go back to his work after operation a while, after we are
After
sure
few weeks. After few weeks. Yes.
after few.
Yes. Maybe if time will allow, they will ask you what are the types of hernia operations that you can offer. Otherwise, yeah, that's it. Okay, good. Thank you.
Thank you.
Yes, Dr. Pravijit, would you want to give feedback first?
Yeah, it was fine. He took
Yes.
the history quite well, and he was sympathetic also. Actually, I gave this history of trauma. I think you have made this stem for inguinal hernia only,
Yes.
which was not in schedule, but I was thinking of infected pseudoaneurysm, for which I gave this history particularly
Hernia
for the
was
trauma.
yesterday's schedule. It was
Yesterday's.
left because no one was here.
Yeah, I didn't know. I didn't know. So I gave everything according to the history, according to the pseudoaneurysm.
Okay.
But anyhow, that's why I mentioned the trauma also. But for
Yes.
inguinal hernia, he asked very well regarding the
Very well.
reduction.
Yes.
But the other things could have been added, like how do you reduce it? What happened? What increases or decreases it? Do it decreases with lying down? Apart from that, everything was
You
covered
did
quite well.
mention the belts. I thought you were, because for hernia people wear belts. So I wasn't thinking that you're thinking of infected.
I mean, he particularly
aneurysm.
asked about for daily living. So even
Yes.
infected pseudoaneurysm could be problematic in wearing belts.
Yes.
So that's why I said that.
Good. 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 Yes. Thank you, both of you.
Thank you.
Cough straining.
Thank you.
Yeah. Dr. Hannah says constipation. Anything increases intra-abdominal pressure. Yes. Could have even been a constipation. So bowel habits, etc. Straining in any kind. I don't think he asked, did he? No. Here is your question. Right, if you have read and understood the question, kindly begin your history taking session now.
Hello, Dr. Sunday, one of the surgical doctor. Can I just confirm your name and age, please?
Hello, doctor. My name is Lisa, and my age is 36.
Nice to meet you, Miss Lisa.
Nice to meet you, doctor.
So I understand that you have some complaint. Could you please just walk me through your complaint, please?
Doctor, I'm not able to breathe properly. It's so difficult for me right now.
I'm so sorry to hear
Could
that.
you help me in that? Could you help me in that?
Absolutely. But first, I would like to ask a couple of questions, so that's okay.
Yeah, doctor, please.
Okay, so I would like to know, so when did you first notice this episode?
So, doctor, actually, I was having this pain in my tummy, and then my doctor told me that I have to go for an operation. And since the time he has told me that, I feel that after that, I'm also having this problem in between. Whenever I think of this surgery, I just feel very afraid, you know.
That must be really hard for you. I'm so sorry to hear that. So this pain, I understand that you have pain in your chest and you're about to undergo some
No,
surgery.
doctor. It's not pain, but it's difficult to take breath. You know, it's not pain, but it's kind of a heavy feeling in the chest. I'm not
Sorry
having
for
any pain.
that. Okay. So this difficulty breathing that you said, can you tell me, like, does it comes and goes, or is it, and how frequent it is?
No, it's not continuous, doctor. Each time I, think of the surgery, I feel that I may not survive the surgery. You know, this thing comes into my mind, and I'm so afraid of surgeries. You know.
I understand surgery can be hard on people, on most patients. But can I just ask, I understand that you said a surgery, when you think of surgery, you get this pain, right? So is there anything that helps you with the pain, that relieves the pain?
Doctor, I'm not having any pain, but this problem which...
Sorry, is there anything that relieves this episode?
Yeah, it's okay.
Anxiety.
So this problem I'm having, whenever I try to relax or maybe distract myself, then this thing, of course, improves.
Okay. And do you have the same episode when you're sleeping?
No, doctor, not while sleeping, but only in the daytime.
Okay. So, and when you have this episode, do you feel like gasping for air?
Yes, doctor. Sometimes I do. It is like I will not take the proper breathe, and I won't be able to breathe properly. It's like I'm gasping for it. Yes, you're true. Sometimes this happens.
I'm so sorry to hear that. So, and does this episode also relate to walking or running or climbing stairs?
No. It happens usually when I'm sitting or lying down and thinking about all the stuff which I'm going to go through.
I'm so sorry. So, together with this episode, so do you have cough? And
a little bit cough, but it's regular.
Okay. So what about do you have wheeze? I mean, make a funny loud sound while you're breathing?
No, nothing of that sort.
How about fever?
I mean, recently, or when are you asking?
I mean, recently, together with this episode.
No, I did not have any fever. I don't remember anything like that.
So how about your appetite? Do you notice any changes in your appetite since this episode has started?
No. It's all fine. I'm eating well.
So how about palpitations? Do you feel your heartbeat?
At the time when I'm having this breathing problem, at that time I do feel my heartbeat, and it's quite loud at that time.
So I would like to, because earlier you said when you think of surgery, right, you get this breast surgery, right? So does it thing happen to you when you feel anxious, apart from during this time, or is it only during because
I do
of the surgery?
No, I have this anxious kind of problem. Even in school time, I do used to have this anxiety episodes a lot of time.
I see, that would be really hard for me. So can I just ask some personal questions?
Yeah, sure. Please carry on.
So have you had any past medical problem, like a heart problem or chest pain?
No, doctor.
Okay. What about surgery?
Nothing of that sort.
What about any surgery?
I had a minor.
Okay. So thank you for your time. I will go. I have to go and discuss with my seniors, and I'll get back to you.
Yes.
Okay, thank you,
Thank you.
doctor. Thank you.
So
History now?
today I took a history of a 24-year-old so who presented with a history of a shortage of breath that that started after from feeling of having surgery, so which always relieved by resting and lying down. And she also has history of anxiety, and she feels this way whenever she's anxious. And every other history, she has no issue of a heart attack or heart chest pain, sorry, or any cough later with the shortage of breath. So based on my findings, my most probable diagnosis will be shortage of breath due to anxiousness.
Okay. What
But I
other?
would also like to
Yes.
consider other differences such as myocardial ischemia, or angina pectoris, or chest infection.
Or pleurisy. Okay. How do
Or
you
if,
plan
yeah.
to manage this patient?
So for this patient, first I have to perform a proper physical examination, chest examination for this patient, perform a chest X-ray, then to also monitor the heart through ECG to
Yes.
just to rule out any other obvious cause from the heart or from the chest. Then after that, you have to encourage the patient to always calm down, and then if there's no other genetic cause for this shortage of breath, then we can also, of course, we can consider patient to see the GP. And if there's any genetic cause, we can always manage it maybe with cardiologist or pulmonologist. Then if there's no obvious cause, then we can advise his patient to take a rest, to relax, and the surgery can continue.
Also, you can maybe involve the relatives in the
Yes,
management
to
of
help
this
calm the patient
patient.
down.
Okay. Do you think the patient's surgery should go ahead or not?
So I think it depends on the outcome of the investigation. So if there's any obvious pathology of the lungs or heart, then we might need to postpone the surgery. But if not, if the patient is calm, then the surgery
Should go ahead.
can go
Yes.
on as planned.
Yes. Good. Then yeah.
I'm sorry. I'm sorry. Like when you mentioned the chest pain, so I wanted to follow the abdominal pain that you mentioned, but that was.
Yes. That was wrong.
But so because you mentioned the abdominal pain, I guess due to the the cholecystectomy, I mean cholecystitis that you wanted to treat. So I really then I started talking about pain.
Yeah, but then
Okay.
patient is scheduled for
Okay,
that,
okay,
but
right.
now
So because
patient
of
is not
this lab
having.
cholecystectomy.
Yes. Okay, yes. But now patient was not having any
Yeah.
abdominal
He
pain.
mentioned to me that he said he had
Yes.
abdominal pain. So when he was talking, so I wanted to follow the
Okay.
pain up just to.
Yes. It was just the anxious patient history taking. Yes. Good. Dr. Prabjit, would you want to give feedback?
Yeah, everything covered in differentials.
Yes.
Just it took a little bit longer than it should be, so he could not cover up everything. The past history and family history and all these ICE,
Yeah.
and
Yeah.
all these
He
things. But
couldn't cover
apart
that.
from that,
For that, Dr.
yes.
Sunday,
So I think
yeah. Yes, please continue.
I
Sorry.
think there are a lot of differentials, and he tried to cover these up very quickly. And I
Yeah.
would say the point which was made by Dr. Abhishek, that we could skip a few things in the
Yeah.
differential. The main diagnosis, we can ask all the questions, but we think that we are not able, or the patient is actually interrupting you a lot of times. So this can happen. For
Yes.
example, with Dr. Abhishek also, where while I was taking the history, the patient can interrupt in
Yes.
between or
Yes.
make you lose more time. So you have
Yes.
to be carry on very swiftly and move on with the thing so that you complete. So this is my thought from today's session. So
Yes.
the patient can waste your time in between.
Can
So you have to
definitely,
be very
even in
cautious about that.
exam. So you have to bring them back on the track. This is also
Yeah.
skill.
So sometimes you're asking the patient about any problem. So the patient may say just no, or the patient may keep on explaining the things and waste your time. So
Yes.
at that time, you should, keep the pace up.
Yes. And Dr. Sunday, like you couldn't get to complete your history, so it would have been good if at the end, when you're presenting, you could say that if time would have allowed me, I would have completed
Okay. Yeah,
the
the ice
remaining
on
of the, yes, please. So in this way, it will be as good as being done, and
Okay,
you
okay.
won't lose the
Thank you.
mark for ice. Otherwise, completing a history taking station with ice is very important.
Very important. Yeah.
Yes, and maybe someone was saying you would have to wash your hands as well because it's COVID going on. So
Uh,
I don't
for
know
for
how
history
much.
taking?
I don't know. You tell me. This
No,
is
no, no,
what
no,
I heard.
No, I don't
not
Okay.
think so. I
No.
don't think so.
not not important
Okay. Thanks.
because station anyways.
Yeah.
I mean, for the purpose of COVID, you can, if I mean, sterlium or something is available, some liquid is available to clean your hands. That's a good
Yes,
thing
yeah,
anyway for yourself,
yes,
but
Not
that does not
compulsory.
count in the marks.
yeah, yeah,
Yes.
yes,
Yeah.
not compulsory.
That's
History
Only in
taking,
examination
it does
station.
not.
Yeah, and only in examination and procedural stations.
Would they give real patient this time?
yes.
Of course, for history taking, of course.
And they will be sitting with the social distancing, keeping
Yes,
this social distancing in your mind.
yes.
With
Or
the
maybe
So you
the
don't
glasses
need to.
with the glasses in front? I mean the cover of the
Yes,
glass?
yes, yes, yes.
No,
okay.
just with mask. Maybe.
Just with
No,
mask
Dr.
or
Sunday, Dr. Sunday could tell that
Yeah.
in the exam was there an actor also, or the examiner himself acted as an examiner?
Actor.
I mean, the actor.
There
Actor
will
Actor,
was
be
there.
actor was
an
there.
Okay,
actor. There will be two examiners,
Two
one
examiners.
for legal time
right.
and one for
One for
Okay.
communication skills and the other one would be surgeon.
yeah.
So
good luck to
good.
you guys.
Yeah, very well. If you're ready, and here is your question. Right. If you have read and understood the question, kindly begin your history taking station.
I'll enter the room. I'll wash my hands. Hi, my name is Dr. Sridhar Murli. I'm one of the junior doctors here today. Can I confirm your name and age, please?
yes, my name is Louis. I'm 66 years old.
Hi, Louis. Nice to meet you. Can I ask what brings you here today, please?
Sorry, you can raise your voice.
Can you hear me? Hello?
Yeah, yes, you can raise your voice.
Hi, I'm sorry. Hi, Louis. I was wondering, can you tell me a little bit more about what brings you to the hospital to us today? I understand that you have a lump in front of your neck, is it?
Yes, if I have this lump here, my throat.
Okay. Can I ask, when did you notice the lump? Can you tell me a little bit more about it? When did you start noticing the lump?
Yeah, this lump started 10 years ago,
10
but
years.
it's not bothering me. I don't do for anything for him, but for a month, the swelling is increased. This lump is increased,
For how
and
many months?
also
How many months have you noticed an increase in the swelling?
um, 6 weeks.
For 6 weeks. Okay.
Yeah,
Right.
it's not a problem with the lump. It's a problem with I couldn't eat well because it's bothering me.
Right. When you're eating, are you having any difficulty in swallowing, or?
Yeah, I have problem
Okay.
with swallowing. Yeah,
And is it for solid food, or are you having difficulty in swallowing liquid food as well?
mostly for solid.
Mostly for solid. Okay. I'm sorry to hear that. Can I ask a little bit more about it? So, other than this, do you have any other problems that is concerning you at the moment?
Yeah, yeah.
Anything else? Would you like to tell me?
Yes, also I have lost my weight. I think it's 4 pounds of my weight
Okay.
lost. And there's something embarrassing me because I'm working as a teacher. As my voice has changed.
Right. I'm sorry to hear that. Do you know how long have you lost the 4 pounds in? How much time?
I think through 2 months, last 2 months.
2 months. Oh my God. Okay. I'd like to ask you some more questions. Do you have any? Do you feel that your appetite has changed at all?
No, not more. Not that
Your
more.
appetite is same, but you're losing weight. Yeah. And what? Are you agitated all the time? Are you nervous? Are you feeling any tremors at all?
Yes, doctor. Yes, I noticed that. I'm not like that before. Now
So you're
anything
agitated
is
more now?
yeah. Now it's
Okay.
more.
Right. But did you notice any change in your voice recently? Has it become a little bit more coarse or anything as such?
My voice, yes, I tell you, my voice is most harsh than normal.
More harsh than normal. Okay.
I need you. Just a second. Come on, help me to
Okay.
close the thing. I'm trying to close it, but I
What
can't
about?
close it.
Sorry.
Sorry.
Are you having any preference towards cold or heat? Do you know? If are you more comfortable when it's cold, or are you more comfortable when
No,
it's
no,
hot?
no, no, doctor. All time I'm feeling hot. I don't.
Hot.
Yeah, all time. If the weather is cold, I don't feel.
And do you notice any fast palpitations on your heart when you're just resting or when you're lying down? Do you feel any your heart racing or anything as such?
Yeah, that's a lot. Especially when I'm going to sleep, I feel my heart loud
Okay.
than normal. Yeah.
Okay. And have you noticed any difficulty in breathing at all? Do you feel that there is any difficulty in breathing? Can you take some
Uh,
breath?
Not that much.
Okay. Now I'd like to ask a little bit more about your other medical history. Are you on any medication at all? Are you following up with your GP for any medications?
Just for controlling my blood pressure.
Are you taking medication for blood pressure? Okay.
Yeah.
Have you had any surgeries in the past at all?
No.
Okay. And do you have any allergies to any medication at all?
No.
And okay, I'd like to know about a little bit about your family. Does anybody else in your family have this problem, or any similar presentation with swellings in the neck?
No one.
No. Okay. And now I'd like to ask a little bit about your personal history, about yourself. Are you working at the moment?
Yes, I'm a teacher.
Retired.
Sorry?
Yes.
Teacher,
A
yes.
teacher. Okay. And what about are you living alone? Are you married?
I have 2 children. I live with them, yes.
Okay. And do you smoke?
Yes.
And do you smoke regularly, or is it occasional?
Yes, I have regularly 1 packet per day.
One packet. Okay. And what about do you drink alcohol?
Occasionally.
Occasionally. All right. Okay. I'd like to ask one more history. I mean, about a certain thing that I forgot previously. I'd like to ask about your menstrual history as well. Are you still having your periods, or is it stopped now?
Stop this. Menopause.
When, I mean, do you recall how long post menopause? How many years it's been?
I think 7 years.
7 years. Okay. All right. Do you have any idea as to what's going on, as to why all these things are happening to you?
I
Do
don't
you
know exactly what happened. Just I'm afraid something is sinister is happened
okay.
for me.
Right. Is there any other concerns that you have?
No.
Yeah. And what are your expectations? What do you expect from us today?
Yeah, if you can help me with this to do for me any scan.
Yes, well, I will do that. Thank you so much for coming in today. I'll discuss with my seniors and get back to you. Is that okay?
Okay, thank you.
Okay.
Can you present your case now?
Today, I had a chance to take the history of Lois. She's a 66-year-old retired teacher, presenting to me with complaints of lump in her neck. On further detailed history, I noticed that she's been having this swelling since the past 10 years. However, swelling has been increasing in size since the past 6 weeks. She also gave me a history of loss of weight of around 4 pounds in the past 6 weeks. Um, there is a history of her change in her voice as well, and she's also given me a positive history of difficulty in breathing and the difficulty in swallowing solid food.
So your main differential diagnosis is?
So my main differential diagnosis would be a swelling arising from the thyroid with features of hyperthyroidism.
Yes.
Could be a toxic multinodular goiter or a toxic adenoma, or
yes.
malignancy arising from the thyroid as well.
Yes. Or thyroiditis. How do you plan to manage this patient?
And for this patient, I do a first complete physical examination along with a thyroid examination of the neck. I would do a triple assessment. First, I would do the history and take proper history and complete proper examination. Followed by that, I like to do an imaging. I'd like to do an ultrasound of the neck with the cytology. So I like to do a biopsy from the thyroid gland to check for the cytology of the gland.
Okay, what treatment options do you think of offering to the patient?
So based on the investigation results, I'll first confirm my diagnosis. And if it's a malignancy, I'd like to think about surgical options. I'll have to first optimize the patient's thyroid status and then plan the patient for surgery after first discussing in the multidisciplinary meeting and then plan for surgery.
Very good. Okay. Yes. Okay, can you, Dr. Zaid, first give feedback?
Yes, he do it perfect. Just
Yes.
I want to tell him when you are analysis the thyroid gland, you should put in your mind the symptom and the symptom related compression. You do the compression perfect, but the symptom related to the eyes you didn't do it, and to if there is any weakness,
Eyes, yes.
yes, proximal weakness.
I forgot.
And diarrhea.
Yeah, and diarrhea. Yeah.
Diarrhea and eyes. Otherwise, you asked about the cold tolerance and sleep. One more thing, please. Sleep disturbance as well.
Yeah.
Okay.
Yeah.
All the rest you covered. Yes, very good.
Yes, it's covered perfectly, really.
Yes. So two types of symptoms you have to cover. One are the compression symptoms. Other ones are the toxic symptoms because it's hyperthyroidism. So yes, very good.
Thank you.
Nice. And you covered within time, and as soon as the bell
I was
goes,
trying to
you
finish
can
within
just
time. That's why I missed a lot of things.
and then as soon as the bell goes, don't have to say, okay, I'll talk to my consultant and get back to you. You can just say, okay, thank you for your time, and then move on. Because you have to be little selfish in this history taking, otherwise you can't just, all ethics cannot make you win. So just say thank you for your time and then turn away and then present your case. So
yes,
this will save few seconds.
In history station, in the first time, you forget examiner at all. When you hear the ring, you just forget the patient completely and to examine.
Yes.
Yeah.
You have to like work tactfully, then only you can complete the history taking in the given time. Otherwise,
you should have two personality in the same time. It's 10 minutes. Yes, one as a doctor, one as a patient or layman language.
Ma'am, I'd like to just pitch in for one of the conversation that I was listening to about Dr. Prabjit asking about whether we need to wash our hands or not.
Yes.
There is, I mean, I'm sorry to quote this, but in past the MRCS, it's available on the group. I checked it from that. There is a marking pro forma that is given in which there is a mark for washing our hands when we